Hello, my name is Lindy Rodarte, and I am here to talk a little bit about breast cancer. On what the signs are, what the symptoms are, and what you can do now to help you further down the road. Let us start off. Let's meet Rochelle. So Rochelle is actually my mother-in-law, and she was diagnosed with breast cancer at age 44. And with Rochelle, her story kind of included just her finding a lump and going to the doctor. But when she went to the doctor was like, oh no, that's just a cyst, you're fine. But something inside of her knew that she wasn't fine. And so she sought further testing, and sure enough, it came back as positive. She took a very aggressive approach with her treatment, and so she got a full mastectomy. And currently, she is now in remission, so she's cancer-free right now, which is awesome, so good for her. As I was talking to her, she said that her biggest advice would be to trust your instincts and to trust your gut, because who knows what would have happened if she hadn't have done that when her doctor was like, oh, that's just a cyst, you're fine. So her biggest thing is to always trust your gut and trust your instincts, because it's better to have something come back as negative than to have it test positive and you not know that it is actually positive. But to me, she is definitely a walking example of hope. She's definitely a survivor, and she's always inspiring and helping others, and she's just the best. What is breast cancer? So, breast cancer is a disease in which cells inside the breast are growing out of control. So think of it this way. You have a garden, you have your flowers, you have your fruits, vegetables, whatever you want in this garden, but you get some weeds in that garden, and eventually these weeds take over the garden and they grow out of control. That's kind of what breast cancer is doing within your body. It's just uncontrolled, and it starts to wreak havoc. Some of the signs and symptoms can include a lump in the breast, any pain in the breast, nipple discharge, or irritation and dimpling. However, there are multiple symptoms for breast cancer, so whenever you have something out of the ordinary, definitely follow up with your doctor and see what they have to say about it and find out some further treatment. So, what is breast cancer screening? Everyone's always like, oh, you need to go get your mammogram, you need to go get tested, you need to find your screening. But what does that mean? So, with breast cancer screening, it basically just means going getting your breasts checked to find if you have cancer or no cancer. So, it is recommended that women who are 50 years to 74 years get a yearly mammogram. However, women between 40 and 49 should talk to the doctor or healthcare provider about just how to go about testing and when to get it started. Because even though breast cancer screening can't prevent the cancer, when it's found early, it's easier to treat. And there's a lot more better outcomes. So definitely talk with your healthcare provider, your healthcare professional, and find out what you can do to get screened. So with that being said, there's multiple tests that you can do, but what is the right test for you? So the 3 tests I want to talk about are a mammogram, MRI, and breast self-awareness. So a mammogram is basically just an x-ray of your breast, and this helps to find and discover any lumps that may be too deep for you to feel, that you may not know about. So a mammogram is the best way to find breast cancer for most women. That's kind of like the top tier of the tests. There's also an MRI, which just kind of gives a better visual of what's going on within the breast. However, because breast MRIs may appear abnormal even when there is no cancer. So for that reason, they're not always used for everyone, especially women that just have the average risk, because you don't want to worry about something if it's not something to worry about. And then there's also just breast self-awareness, just being aware what your breasts feel like and paying attention to any abnormalities and just completing breast self-exams regularly, so that way you're aware of any changes that may happen. Treatment options, there's lots of different treatment options. All the treatment options depend on what stage your cancer is in. Has your cancer spread? Is it just in one area? And it's all a case-by-case study for treatment. So there's surgery, where you cut out the cancer tissue. There's chemotherapy, which uses special medicines to shrink or kill cancer cells. There's hormonal therapy, and this basically starves the cancer cells because cancer cells need hormones to grow. And so, if you are blocking those hormones, it makes it difficult for the cancer to continue growing and continue spreading. There's biological therapy, which works with your body's immune system to help fight cancer cells or control the side effects from other cancer treatments. Cancer treatment isn't always a walk in the park, but thankfully there is technology and there's science to help you to beat cancer. And then there's also radiation therapy, which is using high energy rays, kind of like in how an X-ray works. And this kills the cancer cells. It's kind of like using a laser to target, and you're targeting those cancer cells, and it makes it so though you're destroying it. Hopefully that makes sense for you. But what do you do now? Now you know kind of what's going on, what cancer is, and what some of the treatment options are. So 1 in 8 women will be diagnosed with breast cancer. That is so common. There's so many women that you can just be walking down the street, and 1 in 8 of them will be diagnosed with breast cancer. And breast cancer, you may feel alone. It's definitely overwhelming, but there's a lot of support groups that you can go to. Hopefully you have a family that can help support you and give you some good moral support. I wanted to show you a quick little video that will hopefully help give you some hope during all of this scary time, because breast cancer is scary. Here you go. Okay, so like I said, 1 in 8 women, you're not alone. People have your back, and they're more than willing to help you and support you in any way that you can. But first, you have to take the first step and contact your local healthcare provider, because they're the ones that can diagnose you and help you with a treatment plan. So I definitely encourage you to do that. And I hope you enjoyed this webinar.